everybody, welcome back to my channel. So in today's video, what we're going to be discussing is postpartum hemorrhage. What are the causes of postpartum hemorrhage, how it can be prevented, the effects of postpartum hemorrhage, the consequences. So now, do you know that postpartum hemorrhage can kill? Post, Postpartum hemorrhage is simply means the as in bleeding after birth. Okay, there is one we call that happens after 24 hours, within 24 hours after birth. That is primary postpartum hemorrhage. There's another one that happens after 24 hours after birth. That is secondary postpartum hemorrhage. Now, what are the causes of postpartum hemorrhage? Number one is atonic uterus. If your uterus did not contract after delivery, after you give birth, after pushing out your baby, and your uterus did not contract, as in contraction means going back to its natural state, that state it was before you took in, before you got pregnant, that is what we call the natural state of the uterus. So if your uterus did not go back, maybe because your uterus is flabby or there is retained product in the uterus, it can cause postpartum hemorrhage. Another thing that can cause postpartum hemorrhage is cervical tear. Cervix is the neck of the uterus, all right. So when there is a cervical tear, cervix, when you are in labor, they will be checking you. They will be saying 2 cm, 4 cm, 6 cm. So during the time these things are happening, that thing, as in that organ that they are checking that cm in, is actually the cervix. Okay, so that cervix needs to dilate to 10 cm before your baby can come out, before they can ask you to push your baby. So if for any reason that the cervix wasn't well dilated and you started pushing, that cervix is going to tear, because cervix is the neck of the uterus. That is what we call cervical tear. So when there is cervical tear, it simply means that you are going to be bleeding. You start bleeding from there until the uterus is being stitched. Another thing that can cause postpartum hemorrhage is retained product. Retained product can cause postpartum hemorrhage. Now, how can a retained product cause postpartum hemorrhage? When after giving birth, the placenta is supposed to come out. After placenta, that's what we call blood clots from the uterus. Now, in some women, there is going to be some particles of the placenta remaining in their uterus, or there is going to be some particles of blood clot remaining in their uterus, and they will keep bleeding until those things are out. If those things are not out, that woman will keep bleeding until those things are out. So that also can cause postpartum hemorrhage. Another